Right. So we are going to go live here. Hello, everybody. Good afternoon, good evening, or good morning, depending on where you're joining us from today. We are here to discuss the COVID-19 vaccinations and just sort of go over some information that we have so far. Tonight, I would like to give a heartfelt thanks to our corporate partners and our individual donors. Thanks for making these programs possible for us. So this evening, we're joined by Dr. Jasmine Zain of the City of Hope Medical Center. Hi, Dr. Zain. Thanks so much for
Hi.
being here.
Thank you. Welcome. I'm happy to be here.
Yes, we are so excited to have you. And Dr. Zain is also a member of our Medical Advisory Council. So she's a very valued member, does a lot of things for us. So we're just really grateful and appreciative of your time tonight. The way things are going to work today, I'll just give a brief overview. What we're going to do is we're going to keep it pretty informal. Dr. Zain and I are going to have a discussion surrounding some questions that we've put together, sort of some FAQs, if you will, that we have been getting from folks. And then at the end, we're going to open it up for an open Q&A. So if you have a question during the program, it's probably best to wait a little bit until we get into a couple of the questions, because we may address some things that you've asked. But you can go ahead and submit your questions into the Q&A icon at the bottom of your screen or into the little chat icon too. I will see them all. So go ahead and submit any questions you have. That's why we're here. And I'm just going to start off with sort of a general question here, Dr. Zain. So if someone has cutaneous lymphoma, should they get the COVID-19 vaccine?
Absolutely. So at this point, we know that it is very, very important for everybody to get vaccinated. There are very few exceptions. And I know in the past, so you may have heard in the past for other vaccinations that if you have cancer or you have lymphoma, that perhaps the immune response is weaker and maybe you shouldn't get it. But this is a different situation because we have no herd immunity. So the recommendation is to go and get a vaccination. Your doctor knows best, of course, your case, and you should always discuss with them or ask them. Most of us are very accessible by email, or we want to make sure that we answer all your questions about the vaccination. But having cutaneous lymphoma at the moment is not considered a contraindication to vaccination, and everybody who has this should get it. There are a few exceptions, and we'll talk about that.
All right. So the next one, everybody wants to know, will they have any side effects from the vaccine? Is there anything you would say everybody's going to have, or is everybody different?
Sure. So the vaccination is, there is a side effect and there is an effect. So basically, the vaccination that you will get, whichever one you get, you may have some reaction to it, which is actually a good thing. It could vary anywhere from a slight headache to mild fever, even chills. Some people have had enlarged lymph nodes. So these effects are expected. They are not dangerous. They actually mean that your immune system is working and is mounting a response. So it's actually a good thing. Most of these can be taken care of by simple Tylenol, Motrin, things like that. Obviously, if you can also have fevers. And of course, if you don't feel well in spite of this, you should talk to your doctor. You may need a little bit more support, but these effects are expected. Everybody is different. I mean, some people have just had a mild sore arm or not even that. And some people have had fevers and more severe reactions. So it really just depends on how your body reacts to it. Mm-hmm. Generally, in the studies that they have published, they had seen more side effects in younger people as opposed to older people. But again, that's not always the rule. And the explanation for that probably is that younger people have a more robust immune system and a more robust immune response. Now, it doesn't mean that if you didn't have side effects that the vaccine is not working. So it doesn't work like that either. So don't be worried if you don't have, you don't get a fever or if you don't have any side effects. It's still working. It's just that your body is dealing with it differently.
Okay. I was just going to say, should people be concerned if they're not having the side effects? So you answered that already. Great.
No. Not at all.
So, are there any specific guidelines with the vaccine as it relates to stem cell transplant?
Yes, so we do have some guidelines. Now, remember, these guidelines have been put together after a lot of thought and a lot of discussion among experts. They are, as you know, these vaccines were tested very quickly within a year. So we don't have definitive answers to a lot of questions, but most experts felt that patients who have had a bone marrow transplant, whether it's an autologous or an allogeneic transplant, should wait for 3 months after the transplant before they get vaccinated with COVID-19 vaccine. Again, this is out of abundance of precaution. We don't have a lot of data to support this, but this was a consensus recommendation because your immune system is still recovering from the transplant, so you don't want to tax it. Obviously, you have to be very careful during that time, and transplant patients know about that. They're educated about that. There are some other treatments that can affect your immune response that we know of, and it is recommended if you're getting a drug called Rituximab or Campath that you not be vaccinated, or discuss with your doctor whether the vaccine is going to, that's something that you should take or not. It's not that you'll have more side effects, it's that it may actually not work. Okay. We know that for sure. So right. That's why in those situations, we are recommending for patients not to be vaccinated.
And I heard you mentioned Campath. What about CAR T therapy or other treatments? Are there
CAR T cell therapy? I know there is some of that happening now in patients with cutaneous lymphoma. Again, we recommend 3 months after the CAR T cell therapy to be, to wait for 3 months till afterwards before you get vaccinated. So okay. CAR T cell, stem cell transplant, and then a couple of these chemotherapies that I've mentioned.
Okay, great. If I am fully vaccinated, do I still have to wear a mask and practice social distancing?
Yeah, so that's a great question. The CDC is still recommending that you wear a mask and that you social distance. There are, I think, as time goes on, these recommendations may change, but at the moment, that is what I would recommend, particularly if you're being treated for things, for cancer, et cetera, because again, you're more susceptible to things. And the reason for that is we don't know who's vaccinated, who's not. We don't have herd immunity yet. So we can, there's still people out there who can spread the infection. And we also don't know if even being vaccinated, we are not a vector anymore, meaning we're not spreading the infection anymore. That was not studied in the trials. And again, only time will tell if we actually, we know that if you're vaccinated, the likelihood of getting severe disease or hospitalized is much less than if you're not vaccinated, but we're still not fully sure if we're not transmitting, asymptomatic infections and so on. So the recommendation is still to continue with all the measures of social distancing and hand washing and wearing a mask in public.
Okay, great. We're not out of the woods yet.
No, not at all. Not at all.
Yeah, let's see. If I have cutaneous lymphoma, will my immune response to the vaccine be weaker than someone without?
That's an excellent question, and to be honest, we don't really know the answer to that. But again, we think about this a lot, and it seems like there is no real reason to think that the immune response will be weaker. Immune response is not made of one thing. It's made of multiple elements, and our body, puts all these different forces together. You can think of it to mount an immune response. And even though one or two aspects of that may be weaker, overall the response may be enough to protect you from infection. So the short answer is, at the moment, we don't know. That's the real answer. But if you think about it, we hope that that's not going to be the case. And these studies are actually being ongoing. People are doing research into this aspect of things to figure out if the immune response is weaker or not in patients with cancer. And I think there is a page, the Lymphoma Leukemia Society has launched a study to do that. To really start looking at this immune response in patients with cancer, not just cutaneous lymphoma, but other cancers as well. And I think as time goes on, we will have better answers to these questions.
Mm-hmm. Okay.
But right now, the blanket statement is everybody should get vaccinated and continue to, have all the precautions in place.
Okay, great. And I'm just going to jump over. Someone had actually typed in what about taking rituximab in lower doses for rheumatoid arthritis? Do you know if they would be a candidate to still get one?
So that's an excellent question. I think I don't think the dose amount of rituximab matters that much because it does knock down the B cells. That's how it works. And it's an important component of our immune response. I think there may be some, I mean, I don't know the exact answer to that. So that's the first thing. But my sense is that perhaps I don't think the dose reduction will make a difference. I think they should still not take the vaccine. I think that the recommendation is about 3 months, time between the rituximab and the vaccination, at least.
Okay.
Some people even suggest 6 months, but that's tough. So I'm actually, in my patients who take rituximab, I've started holding it so they can get vaccinated, and then we can resume it afterwards.
Okay. And is there a time after having the vaccine? Is there a time in between that they would need to wait after being vaccinated and taking the medication again?
Yeah, I mean, it's again, I don't know for sure. My practice is to wait at least 6 to 8 weeks after the last dose of rituximab, before resuming the rituximab after the vaccination, to give that time for the immune response to take place. Yeah.
Okay. And folks, it's hard. It's a lot of these things we just don't know right now. So Dr. Zain, we just appreciate you sharing the information that you do have.
Right. And we all try to make use our best judgment, right? So we're trying to do the best for our patients. We don't want them to get the infection like COVID-19. We also want to make sure that they respond to the vaccine. So we're trying to come up with the best scenario, best judgment, so to speak, in each patient scenario. So from what we know, and as I think I think as time goes on, we will have answers to these questions, more definitive answers to these questions.
Okay. Is there anything in particular that patients with cutaneous lymphoma should be aware of as it relates to the vaccine?
Well, I mean, I think one of the things that's coming out, and we're starting to see that a little bit, is the vaccine effect. As I mentioned earlier, we have side effects from the vaccines, and some of these side effects are now showing up in CAT scans, for example. People sometimes have some enlargement of lymph nodes. They have been noticing that on patients who are getting routine scans. And then, of course, if you have lymph nodes in somebody with lymphoma, you get worried. So I think at this point, I know that people are places that do mammograms are wanting patients to wait 6 weeks after their vaccination to get their mammogram, because the lymph nodes can be enlarged and can be misleading. I think the same thing with lymphoma and cutaneous lymphoma patients. If you're getting scans done, PET scans, etc., you don't want them to be too close to the vaccine, when you receive the vaccine, so you don't have these false alarms, so to speak, enlarged lymph nodes or positive PET scans and so on. Again, this is part of the immune response. You may not even know your lymph nodes are enlarged, but of course, if you scan them, you will find that. So these are some of the things we are learning as time is going on about the vaccine. So other than that, in terms of the reactions or responses to it, having fever or sometimes itching. I know there's rashes have been noted after the vaccine as well as part of the side effect profile of the vaccine. So again, in a patient with cutaneous lymphoma, the rash may appear to get worse. So I think if you are going to get vaccinated, you shouldn't be afraid of it, but let your doctor know, so that if some of these things happen, we can take care of those things for you.
Of course, that's great advice. I have heard that immunosuppressive therapy may be beneficial if you get COVID because your body won't overreact to the disease. Is this true?
Very good question. There was a thought in the beginning of the pandemic that may be the case, but that has not turned out to be true. In fact, we have plenty of patients who had a weakened immune system who did not do well after COVID-19 infection. As you know, any infection can be a lot worse in patients who have a weakened immune system, and that is true with the COVID-19 as well. So some of the worst outcomes have been seen by patients who had a weakened immune system or had an underlying medical problem. So I wouldn't rely on that to protect you.
Right.
Yeah.
Okay.
Yeah.
So this has changed a little bit actually since we put these questions together. But are people with indolent cutaneous lymphoma considered higher priority to receive the COVID vaccine?
So they are not, I think they are considered, all patients with cancers are considered high priority. I think it's 1B, I believe. They may change that, but they are given high priority. Again, it varies by state. But I can tell you, cancer is cancer as far as these recommendations are concerned. I don't think anybody's sitting there looking to see who has an indolent lymphoma versus. So if you have a history of lymphoma or cancer, you can, you can enlist in that and be in that category. And that's, and they're not asking a lot of details about the type of cancer you have. So, but I think the vaccines are getting, as of the last week or so, there's a lot more vaccine available. So it should, most people should be able to get it. I think that's the White House announced that anybody who over the age of 16 is now eligible.
I saw
So,
that. That's great.
Exactly.
Okay. If someone's fully vaccinated, but their family or friends are not, can they be around them safely?
Great question. And I think that's what, these are some of the things we're going to run into these scenarios. If you're fully vaccinated and, you are with family that you know and live with, I mean, some of us got vaccinated before other family members and you're living with them. I don't think that changes. Of course, everybody has to still be very cautious and careful, but I would still be wary of hanging out with people who I don't live with. And who are not vaccinated, because they could be carriers or they could have an asymptomatic infection. So you still have to be careful. I think the recommendation now is by the CDC is that you can be, if everybody's fully vaccinated and the period has passed, it's 3 to 4 weeks after a second shot, then you can be in the same, and if you're from the same bubble, so to speak, you could be in a room without a mask in limited numbers. But I think if people are not vaccinated, you still have to be very careful.
I thought I saw something too that they still recommend limiting to 2 households.
Yes,
so
that's
like
true.
two
That's why
bubbles
it has to be people and 2 households. Yeah,
Right,
exactly.
right. Great. So we're going to switch over to some patient questions here. So like I said, folks, if you have any questions, go ahead and submit them into the little Q&A icon or in the chat. I'm reading both. So we'll just start out here. Let's see, should there be any restrictions to participate in a clinical trial without having been vaccinated against COVID-19?
Yes, that's a great question. I think most clinical trials have made a statement about COVID-19 infection and vaccination. So each trial is going to have its own set of requirements. I am not aware of any trial right now that actually requires you to be vaccinated, because it's not available for everybody yet. I mean, it just became available now. So, but that might change. But at the moment, there isn't such requirement, but each trial has now made a statement about presence or absence of COVID-19 vaccine infection and exposure. So,
okay. Yeah. What about, I don't know the acronym, CHOEP infusions and the vaccine? My husband did receive the vaccine. How do we know if it worked? I'm sure everybody would like to know if it worked.
Yeah.
Hard to know.
We don't know. We won't know how it worked or if it worked. The only test is going to be, and it's not a good thing for me to say, would be if you got exposed to somebody who had, got exposed to the infection, didn't get sick. Obviously, I won't recommend that. The assumption is that, it's like any other vaccine that you maybe have some response. You may not be fully protected, but you will have some protection, and some protection is better than none. But how much, it's very difficult to know exactly. If this is a pretty aggressive chemotherapy, but at this point is not a contraindication to vaccination as long as your blood counts are normal in between treatments.
Okay. Okay.
Yeah.
And you mentioned too, there's not a whole lot of data knowing if someone's vaccinated, if they can pass it on to somebody else, it can be a carrier. So just good to be mindful and aware and still be cautious.
Absolutely.
Let's see. Several papers indicate that patients with blood cancers exhibit suboptimal responses to the COVID-19 vaccines. CTCL was not one of the blood cancers, but should we expect that CTCL patients will in fact show suboptimal responses to the vaccines?
I don't know the answer to that. So, but we cannot lump CTCL with other blood cancers, because blood cancers have different affect our immune system differently. For example, if you have a B cell malignancy, that will affect your B cell immunity. CTCL has a very different immune milieu dysfunction. So we don't know the answer to that. It's possible that there may be no effect. And there's also possible that there may be, a different type of effect. Those things are currently being studied. Mm-hmm. So we would know the answer once these studies are done. Mm-hmm. And completed. Yeah.
Great. My treatment for extranodal marginal lymphoma will start in May, end of the week. Does the vaccine during the treatment it is okay, or should I take before or after the treatment?
So it depends on the treatment. For marginal zone lymphoma, there's many ways to treat this disease. If it's a skin marginal zone, sometimes we just inject it, in which case there should be no problem. But if you're getting rituximab, which is also sometimes given, as I mentioned, that's one of the drugs that can interfere with a significant immune response, and it is recommended that you not receive the vaccine if you are receiving a rituximab. But if you're planning to receive, if it's something that's going to happen, and your doctor wants you to take it, it's perhaps a good idea to get vaccinated before
Okay.
you start treatment with rituximab.
Okay. It looks like we have a couple of same question here. Basically, folks would like to know, is there a recommendation for CTCL patients to get tested for vaccine antibodies after being vaccinated? Or is there even a way for that?
Yeah, so that's a great question. People are doing it. I mean, on their own. There's no recommendation at this point. I've even talked to my infectious disease doctors, and they are not in favor for doing that, because the problem with these tests is that they do give you a number, but they don't really mean anything in how your immune response actually works, because it's just one part of the immune response they are testing. And it's different everywhere. The antibody test that they're talking about, each lab has its own version of it. So it's very difficult to make any any real sense out of it, in the sense that if you have antibodies, or if it's really going to protect you from an infection or not, because the immune response is not just antibodies, it's also your T cell responses. It's a complicated series of events, and then what you're testing is just one part of it. So there's no clear recommendation that everybody should be tested. People do it on their own for their own satisfaction. Again, scientists, researchers are trying to make sense of this, and I'm hoping that at some point we will have a more comprehensive way to test these responses. But
It sounds like at this point, would it almost offer more confusion than anything to folks then?
Yeah, I wanted to get myself tested, and my infectious disease expert at Astra City of Hope said don't, because you wouldn't know what to do with that information, and you'll get
Right.
fixated on that number. So yeah.
Okay. Especially, folks who don't have a medical background, that could be
Right,
confusing or
exactly.
scary, and it may not even give you information that
Exactly.
you should
But if
have.
you have if your institution is running a clinical trial, like City of Hope is, they are looking at these antibodies in specific diseases, then you should, if you want to, you should participate in that, because this is exactly what they're looking for.
Okay.
They'll test you, and they'll see if it means anything down the line.
Okay.
So
Great.
yeah.
Great. Let's see. So then someone asked, are there antibody tests that have a higher degree of accuracy? Do we even know that yet?
No, we
Okay.
don't. Every lab has its own way of testing for these different proteins, the different spike proteins, and so on. There's neutralizing antibodies. There's all kinds. Even when you read the papers for these vaccines, there you have to be very careful about what testing they're using. It's not standardized at all.
Okay. And I don't know if you sort of already answered this, but someone asked, will vaccinated patients build antibodies to COVID?
CTCL, vaccinated
Yes, I'm
CTCL.
sorry, vaccinated CTCL patients.
They should. I mean, they should. We know that they do build, and we do know that CTCL patients build antibodies to other antigens. So they should be able to build, some antibodies to COVID proteins as well. That's why we're recommending that the vaccination happen. Yeah.
Okay.
How much, I don't know. Yeah.
Right. To be determined. Let's see. Can getting the vaccination cause you to break out if you aren't broken out now? I am under control with UVB. I'm 2A. And Dr. Zain, I'm going to read through the chat here now in case you'd
Sure.
like to follow along.
Sure. I mean, vaccines have been, some patients have developed rashes with vaccines. So yes, if that's a skin breakout, then yes, it can happen. It doesn't last for very long, usually a couple of days, and it goes away because it's just a reaction to the vaccine. But again, I don't know if you in particular will break out into a rash or not, but there is a possibility you might. It's low, but again, let your doctor know if that happens.
Okay, great. How far apart do you recommend getting the vaccines? I have read mixed information that those with an autoimmune disease should receive their doses closer together to be more effective.
I don't think there's any scientific, at least in my understanding, any scientific background to that. So, basically, the 3 to 4 weeks, 3 weeks with Pfizer, it's actually 14 to 21 days, and then 48 with Moderna is based on the fact that they wanted to give a booster shot. And this is the way the trials were designed, but that doesn't mean that's the only way to do it. If you think about the immune response, the booster is basically there to strengthen your immune response. And the timing, you don't want it to be too far out from the first one that the first response just dies down. You're just boosting it. So anywhere from 3 to 4 weeks, maybe even longer is fine. I don't think there's any data that if you have autoimmune diseases that you should give them closer together. In fact, being closer together is probably not going to make it more effective.
Okay.
Yeah, because you've not had enough time for the first one to respond, right? So then you
Right.
give a second one. So
Okay.
you
And you
need to
said
kind of prime the system. You need to prime the system to give the
right.
booster.
Okay. So you said 14 to 21 for Pfizer and
Yes.
28 you said for Moderna?
And that's how they designed the study. And that's what the CDC is following. Yeah.
Great.
At least 14 days between the 2 Pfizer shots. Yeah.
Okay. Perfect. And I'm sure wherever you're being vaccinated, they will give you that information. They'll provide
Yes.
you.
Yeah, they won't vaccinate you. They won't give you the second shot 7 days after. That's just not going to
Right.
happen. That's
Right.
why they want you to bring your card with you so you know when the first shot was and so on.
Yep. Okay. Great. Let's see. Okay, that's another antibody question. The booster 4 months apart is okay. I'm in Canada, so I don't know if we have that information.
We don't. I mean, I don't know the answer to that. My thought is it might be okay. Because again, it's a booster, and what we know of boosters from other vaccines, they don't always have to be done exactly the same time. 4 months is a little bit longer. But I know that there are going to be situations, millions of people are vaccinated. I'm sure there are situations where the person can't make it to the second shot, or they get sick, or something else happens. You should still get the booster as soon as you can get it.
Okay.
So there was also a question about how long does the lymph node swelling last after being vaccinated?
Oh, thanks. I skipped right over that one. Yes, thank you. How long does the lymph node swelling last after being
Yeah,
vaccinated?
it could be from 4 to 6 weeks
Okay.
or less, but that's sort of like the longest it will last, but most of the time within 1 to 2 weeks it goes away.
Okay, great. Thanks for catching that one. And I'm going to jump back into the Q&A icon here.
Sure.
So, is there a study that is close to a comprehensive test for coverage?
I'm not sure I understand that question. Is there a study that
I wonder if they mean to test
coverage?
bodies, perhaps, or
Is there a study that is close to a comprehensive test for coverage for COVID-19, I guess?
I would assume for CTCL patients. Whoever typed that in, if you'd like to add any follow-up, maybe we can come back to it if you had any specifics you were interested in knowing about. Let's see. How long is it recommended to wait to start rituximab treatment after getting the COVID-19 vaccine?
Right. So I don't have an answer to that. Generally, the recommendation is 3 to 6 months actually after the vaccine. I've been waiting maybe 6 to 8 weeks to get my patients back on treatment, depending on how quickly they need the rituximab. But the recommendation is about 3 to 6 months.
Okay.
Which, in this pandemic to me seems very long because, what if you get COVID during that time? So.
Right. Is there any information on if someone receives the first dose of the vaccine and then they end up getting COVID in between before getting the second one? Should they wait to get the second one? Is there any data on that?
Yeah, that's happening. Because remember, the first one doesn't completely provide you protection.
Right.
That has happened. They do recommend to wait. I think it's 3 weeks or 4. Is it 3 weeks or 3 months after the? I know that if you have COVID infection, they recommend you start the vaccination 3 months off if you haven't started after 3 months. Yeah.
Okay.
The second dose, I don't know the answer to that. I think you
Okay.
have to talk to your doctor and see what they want to do.
Okay,
Yeah.
great. But it sounds like definitely
In between, if you
delayed.
get COVID, they may want to postpone that a little bit longer. Yeah.
Okay. Just talk to your doctor and
Yeah.
okay, let's see. Would you recommend that all CTCL patients get the 2-dose vaccine, or is it okay with 1-dose vaccine? And I assume they're talking
Oh,
about the Johnson.
yeah, there is, at this point, we don't have any recommendation one way or another. The recommendation is to get whichever one you can.
Okay.
So if you're getting the Pfizer and the Moderna, you should get the 2 doses. If you're getting the Johnson and Johnson, when that opens up again, it's a 1-dose vaccine. But obviously, as you may have heard, there are some issues with that vaccine, and the FDA is looking into it to see if it's safe to give it to people, or if there's going to be a special group of people who should not get it. I think that's where it's going to come out to be. But whatever the FDA and CDC recommends, whenever they recommend that it's safe to take it, it's a 1-shot vaccine. Sorry about that. Yeah.
Attention to patients, I'm sure. Do you need to get that? Are you all right to continue?
Yeah, just you can. Yeah, can you do me 2 seconds? Let me
Of
just.
course, yes. I think
Sorry about that. Yeah.
no problem. Take your time. I think we can all
I'll just tell her to.
Dr. Zain is catering to her patients, and we are all appreciative of that. So,
Hi, I'm on a webinar. Can you wait for about 20 minutes? I'll give you an answer. Thank you. Okay, bye-bye. Sorry about that. Okay.
no problem.
All right, so let's see. Next question. This is so much fun. I'm having so much fun.
I'm so glad. We're so grateful. Let's see. Do you recommend that patients who are over 65 get the Shingrix vaccine after the COVID vaccination?
Yeah, so I have made this up myself. That I tell them you need to get the COVID vaccine first, give your body time to recover and react to it. So and then the Shingrix vaccine or other vaccination should be done after that, about 6 to 8 weeks after that. I'm doing that for all my transplant patients as well, because they get, and same thing with the Shingrix. But again, this is my practice. We don't have a lot of data, but I think most people would not want to give you multiple vaccines at the same time, especially a newer vaccine like COVID-19.
Right. Okay. So you personally are recommending that your patients get the COVID vaccine as the priority.
Yeah, absolutely. Absolutely. I think everybody is, and most people would want, because there are side effects and so on, they don't want them to mix up the vaccines together. And so wait 6 to 8 weeks between other vaccines.
Right. Okay. Are MF patients considered inherently immunocompromised?
Yes, they are, because the disease is, by itself, even in early stage disease, there is some dysfunction of the immune system that actually makes the disease progress. So they are considered to be inherently immunocompromised, even in early stage disease, even if they're treated. How much it will vary with the extent of your disease, obviously, but yes, the short answer is yes.
Okay. And I think we may have mentioned this, maybe somebody jumped on here, but is it okay to get the vaccine if you are taking brentuximab?
Yeah, I've been giving that to my patient. Yeah, absolutely. Brentuximab is not as immunosuppressive as Rituxan. Yeah.
Okay. Is it okay to receive the Astra Zeneca vaccine as a CTCL patient?
Yes, it should be. I don't think there's any contraindication for CTCL per se. So you should be able to get that if that's what's available to you.
Okay. I have a couple of questions that were submitted ahead of time, and folks, we're just going to keep going. We can take up the whole hour if we need it, if we have questions, and if we don't, we'll wrap up early. So if you do have those questions, make sure you submit them into the chat or the Q&A. So let's see, the next one. Do patients with mycosis fungoides who do not have blood involvement develop antibodies sufficient to resist COVID-19 if the required injections are administered?
Again, it's kind of goes back to some of the questions we answered earlier. Having blood involvement doesn't make you any different than any other patient with CTCL or other blood cancers, in that sense that we don't know how strongly you will mount an immune response or what kind. The blood itself is the malignant, is a malignant T cell, so those are not going to interfere with the immune response per se, because they're there. But in general, because of the disease condition, there may be a modified immune response in patients with CTCL.
Okay. And I'm assuming you can't answer this, but someone has asked, when are we likely to get more information, which I'm sure everybody would like to know.
Yes, so those studies are ongoing. I would say in the next 3 to 6 months. So stay tuned.
Okay.
Yeah. Because people are trying to rush this, there's lots of trials ongoing. There's lots of studies ongoing. So the data will start coming out.
Okay. Let's see. Is it safe if I have MF to get the vaccine? I know you answered that, but then they added, since T cells are involved, is one manufacturer safer than another?
We don't know.
Okay.
I mean, in my mind, I was just talking to Hillary about this. In my mind, the Pfizer and the Moderna are very similar vaccines. You know,
Right.
they're different manufacturers, but the technology is very similar, and how your immune response is going to happen is very similar. The Astra Zeneca and the other viral-based vaccines, not the messenger RNA-based vaccines, are also very similar. So I suspect that it's going to depend on the person's immune system rather than the actual vaccine, about how the response is going to be, if that makes any sense to you. It's what cells your body is going to, is how your body cells or how your immune cells are going to react to that vaccine. But the
Right.
vaccine per se is, I don't think they're that different. In fact, I don't think they're that different, between the messenger RNA and the adenoviruses as well, because the idea is the same.
Mhm.
Yeah.
Okay. Back to the antibody test topic. Someone has asked, for those who have had the vaccine and are not sure if it is effective due to lymphoma and prior treatments with rituximab, can the antibody test resolve any of those uncertainties?
You can get it tested, you can get it done. There's different kinds of tests out there. I mean, if you want to just see if you have a response, you can certainly check it out, but there's no way to tell if that response actually correlates with efficacy. So obviously, if you didn't have any antibodies, that would be somewhat concerning. But I think if you have something, we don't know how effective they are. So there's no standardized testing, which is why this is complicated.
Right, of course. The person who had submitted the question earlier,
Yes.
is there a study that is close to a comprehensive test for coverage, has clarified a test to see if one is covered by the vaccine? Okay, so we've sort of already addressed that one.
Yeah.
Has anyone that you know of with MF reported any reactions from getting the Pfizer vaccine?
Like normal reactions, like
I would assume that I assume that this person is meaning any reactions as it relates to the MF.
I'm not aware of anything that I have seen after the Pfizer vaccine for MF. There are a couple of people, a couple of patients who may have had, but again, we don't know if it's related to the vaccine or not, seemed to have a relapse. At least one patient who seemed to have a relapse of their cutaneous. It wasn't MF, it was another type of lymphoma. But again, the lymphoma was expected to relapse anyways. So I'm not sure if the vaccine made a difference or not, but the timing was suspicious.
Okay.
But I think for the MF, I can say all my patients have tolerated it very well.
Okay, great. And again, it's probably too soon to know for a lot
Yeah,
of the
exactly.
too,
Exactly.
so.
Exactly.
It looks like we have one more question.
Sure.
Do you recommend getting your white cells count tested before the vaccine? I had a friend who had to wait because her count was low.
Yes, so they do recommend that if you are getting treatment, chemotherapy particularly, or anti-cancer treatment, and your ANC is less than 1,000, that you wait till it recovers. So, and that has to do with the actual vaccine, the injection, because when your ANC is low, injections and things like that can lead to infections. So that's probably why they want you to be, and again, this is out of abundance of precaution. Generally, when your ANC is low, we try not to do any procedures on you. So that's where it's coming from.
Okay, great. So we're out of questions here tonight. Thank you, Dr. Zain, so much. If everybody sees, I've just launched a poll.
Okay.
Let's see. Oh, I'm sorry. Someone just added, my husband takes Nelusta after brentuximab. Is that okay?
Yeah, that's fine.
Okay.
New last stuff. Yeah, that's fine.
Great. Thank you, Nilasta. And someone has also asked, will this be recorded? Yes, we are recording. This will be available on our website within about a week so that you can rewatch and pinpoint any specific questions. If you have anybody you want to share the information with, please do. And Dr. Zain, thank you so much. We are so grateful for your time. This was wonderful. We know there's limited information and you did such a wonderful job at explaining what we do know. So thank you.
Oh, you're welcome.
Yes.
All right. Good. Best of luck, everybody. Okay, stay safe out there.
Yes, everybody
All right.
stay well, be safe, and if there's anything we can do for you, as always, don't hesitate to let us know. So with that, we're going to wrap up, and thank you so much, Dr. Zain. Have a great night, everybody.
Thank you.
Good night.
You too. Thank you. Bye-bye.